Hello, and welcome to the Cycle Endometriosis podcast, where we will delve deep into experiences, challenges, and triumphs of those navigating a life with endometriosis. Join us as we share the stories of resilience, offer insights from experts, and foster a community of support for those affected by this often misunderstood condition. Whether you're newly diagnosed, a seasoned warrior, or seeking understanding, I hope this podcast is here to help empower you and uplift you on your journey. Tune in as we break the silence, shatter stigmas, and amplify the voices of the endometriosis community. Medical disclaimer: this podcast is not intended for the purpose of providing medical advice. All information, content, and material of this podcast is for informational purposes only and is not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. Thank you so much for being here, and now on to the show. Hello, everyone. Welcome to this month's episode of the Cycle Podcast. Thank you so much for being here. I'd like to give a warm welcome to our guest today. Carey, thank you so much for joining us. So happy to have you here.
Melissa, it's really nice to be here. Thank you for having me.
We look forward to talking to you today and learning all about you and a book of poems that you have published that we're going to chat about in this conversation. But before we dig into the endo journey, why don't you tell us a little bit about yourself?
Yeah, absolutely. Well, as we were talking before we started recording, I grew up in Michigan and I now live in New Jersey. I'm a poet. I received my master's in fine arts in poetry in 2006 from New England College. And I have two other books of poetry that I've written before this one that we'll talk about later, The Hungriest Stars. I work as the executive director and publisher for a poetry press. I've been there. I'm going into my 19th year. But, I think maybe like many poets, I never realized that I would ever be a poet or wanted to be a poet or thought that I would, end up being a poet. I was actually going into medical school. So it always seems very surprising to me when I say that I've been in my role at Alice James for as long as I have been, because I just never imagined my life that way. And I have one little dog named T. Tobias Toblerone. He's a Cavalier King Charles Spaniel. And I love to snowboard. I'll be leaving in a week for my first backcountry snowboarding trip in Japan. Very excited about that.
Wow. Well, congratulations on your success, and thank you for sharing that of what your journey has been with poetry. That's really incredible. Yeah, 19 years.
Yeah, it seems really strange. It seems like sometimes like the longest time, and then other times like it's been like no time has passed at all, which I guess maybe is like a really good thing when it comes to your career.
Yeah, absolutely. Yes. Oh, well, a snowboarding trip too. That's going to be incredible in the backcountry in Japan. Wow. How long are you going for?
I'll be over there for about 2.5 weeks total in
Incredible.
Japan, but the snowboarding trip will be about a week. And we can definitely talk about this later, but this is definitely something that like severe endo would have prevented me from ever dreaming that I could do.
Yeah.
So
Yeah,
it's
absolutely.
really special and unique to get to do it.
Yes, absolutely. Yes, I totally get that. Well, speaking of endo, when did you first realize that something was not right? Or you
Well,
started to feel not right even?
yeah, I would say I don't know if this is a common answer because I feel like I have not, there's not a lot of data out there for us to kind of cross-check our stories, and I think that's why this is such an important podcast and such an important thing for all of us to continue to talk about and keep front and center. Um, I feel like I knew right away. I knew right away. I got my first period when I was 12. And I remember being in, like every month after that, I would be in an emergency situation in the bathroom in grade school, just trying to figure out what it was that I was supposed to do, in horrible pain. And then just really, very intense bleeding, and just trying to wrap my head around, I guess, as a child, as a 12-year-old, not even a teenager yet, whether or not that was actually normal. Like wondering, when I was alone in there, whether or not I was going to get in trouble, how I was going to explain this. I didn't even have language to explain it. None of my other friends were experiencing this. And so I didn't know how to talk about it with them. Um, I think I when that all started happening, I felt a lot of shame and guilt, like it was something like I didn't know how to manage properly.
Yeah, I
But
think that's a
immediately,
yeah, I mean, it's a good point though to bring that up of the shame and guilt. And I think you described it really well of like being in that space alone. Like, am I going to get in trouble? Like, why aren't my friends talking about this? And I always say in the show, like, I thought everyone was going through it, but no one was, like, it was a secret and you weren't allowed to talk about it. And so I was
mhm,
just like, oh, everyone's going through this, but we just don't talk about it.
yeah.
I had no idea. I thought everyone was struggling in the restroom like that, you know? Okay, so at a young age, you knew something was off. What happened next?
Well, what happened next, I think, is what probably happened next for most of us, which is that, I had those feelings, but I also felt like, it was like a me problem. Like I didn't know how to manage it properly. So everybody else is feeling this way, but they're not struggling the way that I am. So, I just have to deal with it. And so that's what I did. My father is in the medical field, but wouldn't really ever even use like proper terminology for menstruation products. So, it was not something that we talked about in our house, and not something I think I ever felt comfortable raising with either of my parents. The fact that I was really struggling. I think that the assumption was that, this is something that happens, to and for all women, and we're giving you have everything you need at your disposal to help you manage this aspect of your life. I took a lot of Midol, and and then in my latter years, like in my high school years, I just remember too, like I would take so much of it, I'd just be like throwing up. I had like overdosed myself on pain medication.
Yeah.
Um, and it was, I think what I did was I lived in a lot of fear. I was constantly afraid I was going to bleed through my clothes. I did sports, and I was constantly afraid that, like something was going to happen. I would mess up my tracksuit. I would mess up my cheerleading lollies. Like I would stand up and, something embarrassing would happen.
Yeah.
I just lived with a lot of anxiety and a lot of pain, that just continued to grow the older I got. Like it was, thinking back on when I was 12 and I knew something wasn't right. Like think about that, and I'm like, where I ended up when I finally got treatment for it. Um, there was a steady escalation.
Yeah, that was going to be my question. So throughout like middle school, high school, as you're progressing, did you start to like miss school? Did you start to like disengage a little bit because things were exactly like what you're saying, escalating?
Yeah. Well, in high school, I was a really dedicated student to academics. So like one of the things that, was like I wouldn't miss, I wouldn't miss school, but I would like, double and triple up on like all the, on like tampons and pads to like like try and like underwear, just like make sure that, I didn't have, or like I would plan ahead on the days, just like making sure that I was constantly taking medication, making sure that I was like always stopping in the bathroom. And I think that it didn't necessarily mean disengaging from my academics, but it definitely meant disengaging from like my friend circle. Like I
Yeah.
didn't have a lot of time to socialize or really think about, I think, things that maybe normal teenage girls were doing at things. Like I wasn't wearing and fixing makeup, in the
Right.
bathroom. Like if there
Right.
wasn't any of that. It was me, just trying as best as I could, to manage what my body was doing, despite the things that I wanted to do, and needed to do. Um, so you know at that point, no. Later in life, I did start to, when things started to get really really serious, then I did have to start really pulling back from like, going out socially, that
Yeah.
kind of stuff.
Yeah, when was that? So like you go through, you're kind of,
Yeah.
you're dealing with it, right? You're just living with it. But then there must have been a peak in the story where you started to be like, okay, I need to see a medical professional. Something is really like, you knew something was wrong, but now it's like, this is next level.
Yeah. Well, I'll say that there were two things. When I knew that it was really inhibiting my life, I had mentioned before, I work as in publishing, and I work with a lot of astounding literary artists, a lot of amazing writers and poets who win a lot of, win these incredible awards, and then I get the opportunity sometimes to accompany them, to celebrate them in their accomplishments, in these ceremonies. And I had an artist, who was being inducted into the Academy of Arts and Letters in New York. And it was a really big deal. He had just published one book, but he is such an astounding writer. And he had asked me to accompany him, to participate. It was so beautiful, so moving, so touching. It makes me feel like I want to tear up, like just thinking about, how meaningful it was, for both of us. And and I had to back out of the plan because and I couldn't do it with like a reasonable amount of time, because it's not like, your period really like announces itself,
Right.
like a week or like even several days ahead. You get it, and then you know what your worst days are. And um and I knew this was going to fall on my worst day, and at that point, like, there was nothing. I couldn't leave my house on those days. I could not. I don't even know how to say, like, how to describe it, but like I couldn't stand. It's like I was like, the amount of blood that I was losing, like it just made it impossible to do anything
Yeah.
but just like be on the bathroom floor, or in a room like adjacent to a restroom.
Hmm.
And I couldn't explain to him, because it's not something that really people understand or know about or talk about. So I couldn't really tell him. And I had to like tell like a white lie about it. And it just felt off. Like the whole thing felt awful.
Yeah.
And I knew then that I really needed help for that. And simultaneously, I was trying with my spouse then to get pregnant, and was incapable of doing so. And the doctor that we were working with, the reproductive endocrinologist, was like, "I think you have endometriosis, and this is how we die. This is how we diagnose it. We give you surgery."
Wow. And after all that time of leading up to it, how many years later was this since you turned 12?
So this was 15 or 16 years later.
Yeah.
So I was like
Yeah.
27 or 28.
Yeah.
Um, around that age. And it took that long,
Yeah.
really.
Yeah.
Which is a shame,
Oh, it's
not just for
unacceptable.
me.
Yeah,
Right.
it's just it's unacceptable. And in that time, we're talking about like around your cycle, you knew like you're not leaving the house, you're staying next to the restroom. Totally understand that 100%. But were you starting to notice like even like during off times of your cycle, like things were just you were in maybe more pain or like bowels or just any other symptoms that you on the off weeks that you're like, gosh, fatigue, like you're just everything, and you're like, what is happening to me? I'm in my 20s.
Yes. Yes. 100% yes. I would say that I feel like this is generous. It's generous to say that half the month I felt good.
Yeah.
I don't think it was really half the month. I think if we're talking about 15 days, that's generous to say for 15 days a month, I felt okay.
Mm-hmm.
Maybe like half of those I felt good. But, like I never, the abdominal pain, like the blaring, you know, which a pain that I later came to understand was, my organs adhering together
Mm-hmm.
and
Mm-hmm.
sticking to, the wall of my pelvis,
Mm-hmm.
like, um, the joint pain, the headaches, the just like the general, like all the like the immense bloating and water retention, the intolerance for foods, definitely the digestive issues that I experience, like so sensitive, like even now, like, as we talk about, how things have progressed for me, um, I have to watch my diet just
Yeah.
so carefully. And I know whenever I put something in that's like a trigger for the endometriosis, like that's like a numbers game. It's like,
Yeah.
do I really need
When?
this? Do I really
Yeah.
want this? Do I really want what's going to happen after I have
Yeah.
this?
Yeah. Or there's the time you eat something and you think it's okay, but then you don't know it has like something in it, and then you're like, what did I eat? Like, why am I
Yeah.
doubled over? Why is my stomach so bloated and in pain? And people think, oh, bloating is extremely painful. It
Yes.
People who are slightly bloated from maybe like a fizzy drink or something, they don't understand this level
No,
of bloating. It hurts.
it
It's like
hurts.
your skin hurts because you're
Yes.
so distended. And yeah.
Yes. Yes.
And I mean, talking about, thank you for sharing those symptoms, because I do think it's very helpful for people still very much like question in the beginning of going through this, like, is this really endo? Could this be something else? Because of, like we talked about earlier, just the lack of awareness and knowledge and how it really affects people. But I'm so happy that it's finally being reframed, that it's a full body, like systematic inflammation disease. It's not just a period disease or like a cycle disease. I think
Right.
that like intensifies it because you're so inflamed during that part of the month, but you can feel sick every day with this. It has nothing
Yes.
to do with your period.
Yes. Yes. You
And I
absolutely
just,
can.
yeah, it's so wild, and I want to hear from you, but like even for me, I was just like, oh, I need to go to a GI doctor, I need to go to a dermatologist for my skin, oh, I'm having headaches, I need to go to this doctor. I had no idea that this was all connected.
Right. Right. That it all stemmed from the same thing. Yeah. You
Yeah.
think you had to go all these different places. Like I
Yeah.
remember, having a colonoscopy in my early 30s because I had a lot of pain and bleeding. And
Hmm.
I didn't put the two. I should have been able to put the two together, or better yet, maybe not me, but like my general
Yes.
practitioner. Like my
Yes.
general practitioner should have been able to put two and two together,
Yes.
and say, oh, I see in your chart, you have a history of significant endometriosis all over your bowels. Maybe that has something to do with this.
I mean, this is like we're figuring it out on this podcast right now. I don't understand. Like, yeah, I totally agree. Okay, So you're at the fertility specialist and they mention we think you may have endometriosis. What happened after that?
Well, I had to have a couple of procedures. One was a hysterosalpingogram, which I don't know if you're familiar with that procedure, but
I'm not.
they do two things. They take a rod and they they insert it into the uterus and
Okay.
like sound it,
Mm-hmm.
like tap it, and then they
Ouch.
record, what, yeah, it's horrible, but it
Yeah.
doesn't, you can but the doctor would be like, oh, just take a couple Motrin, it'll be, it's totally fine.
Of course they are.
Right. It's just it's discomfort, you're just going to feel some
Yes.
discomfort.
Yes.
And then the other part of that, after they do the sounding, they remove that instrument and then they inject a dye into the uterine cavity, and then that dye is supposed to move through the fallopian tube and out into the ovaries, and they
Mm-hmm.
capture the movement of that dye to see how free the fluid is flowing
Mm-hmm.
in that cavity, like basically how well the organs are working.
Yeah.
And the dye did not go anywhere. So, both of my fallopian tubes were crushed by endometriosis, like just snapped shut,
Mm.
wound up. Um, and so, in addition to, the diagnostic procedure for endometriosis, which would come later, that already put on the docket that I had to, have those tubes reopened,
Mm-hmm.
or cannulated, I think is the term that they used. So after that point, after I had that diagnostic procedure, I went in for the laparoscopy and the laparoscopic surgery,
Mm-hmm.
and that took hours. It took 4.5 hours. The doctor was not expecting that. They had a lot of issues. They found endometriosis on my ligaments. A lot of my organs were adhered together, so they had to,
Mm.
release those. Like I had mentioned before, I had significant endometriosis lesions on my bowels. I had chocolate cysts. I had, maybe related or maybe unrelated. I had a septum and several uh, fibroids in my uterus that needed to be removed. I had basically like a whole, it was like, I would say it was close to like a reconstructive
Yeah.
surgery.
Yeah.
And there are two different ways that doctors will remove the endo. They'll go in and burn it, right? That's like an
Mm-hmm.
ablation. And then they'll go through, or maybe this is like the ablation where they cut it. And my doctor
That's
cut it,
the excision. Yeah,
the
the
excision.
excision.
Yes.
That's the
Yeah.
like gold standard for the treatment.
Yes. So that's what he did. He excised the endometriosis on my bowel, on my ligaments, all over, in the wherever he could find it,
Yeah.
basically.
Yeah.
And I remember waking up from that surgery and he was so pleased with himself, and great. Like, you feel like you did a great job, buddy. That's great. Like, we're happy. I'm happy you did a great job. But the thing that always would stick with me is that he said, I cured you. You're cured.
Mm.
You don't have it anymore. I got rid of all of it. You're never going to feel that way again.
I have a feeling that you're going to tell us that you start to feel that way again.
I know exactly when that happened. It was 8 weeks later, right before we were going to, I was healed enough to start the IVF treatments,
Mm-hmm.
and I had to wait for my period to come twice. That was what they needed. They needed like it needed to come back, and it needed to, like,
Mm-hmm.
restart, and be like consistent.
Yeah.
And when I got that second period, I it was almost like I had a stomach virus. I don't know how else to describe it. I had some of them, it was like, or like I was in labor. Like having had a baby, I guess maybe I do kind of liken it to that. Like I was in so much pain. I remember like I might have passed out or nearly passed out in my bathroom, and my legs were just like it felt like someone had lit my nerves on fire.
Yeah.
And I was just like blinded and just hysterical, like alone, because I didn't wait,
Yeah.
I did not wait. I wanted to experience it alone. Like, you want to be
Yeah.
alone because you feel so
Yeah.
terrible. Like you can't
Yes.
comfort anyone else, or you don't want to talk about any of the pain or use
Yeah.
any energy at all that you're using to manage your pain to tell anyone what's going
Yeah.
on even. And it was just devastating.
I'm so sorry that that happened to you. Awful.
It was awful.
Yeah.
But I'm not the only one. This is
I know.
like
I
my
know.
story is everyone's story. Like it's
I know.
just, I think of it as when it happened to me, and then the first thing I think about is like so many women this has happened to. I am not the only one, and it really, it's terrible. It's
Yeah.
terrible that,
It's unacceptable. It's unacceptable that you were told something and thought like you probably left there so happy
oh my
and
God, I was
relieved.
so
Of
happy.
course.
I was so
Of course.
happy.
I had no idea this was a chronic condition until after like my third or fourth surgery. I thought every time I was like, "Woo, it's cured."
Yeah.
I had
Yeah.
no idea. Even doing, and I'm sure you did some online research when they first mentioned it, and you probably reflected back and was like, wow, this is really what I've been struggling with for 15 years.
Yes. Yeah.
And so just to hear someone say that you're going to be fine and not experience this anymore, and then you do, it's literally heartbreaking.
Yeah. Yeah. Yeah, I was really distraught, and it just made me feel like, I don't know, maybe resigned a little bit. It's just like, okay, I guess this is my life, you
Yeah.
know?
Yeah. Yeah.
And, you have to accept it, but then you realize like all the limitations that are put on you, because of it. It just feels so heavy.
Yeah. Yeah.
Um, then I mean, and I lived that way for a long time. Had ended up having my son. Again, they were like, "Hey, pregnancy cure." I just like I love all this like misinformation that floats around as facts in the medical community. Like when the
Yeah.
doctors are all like, "Yeah, let's just tell all the pregnant people that pregnancy cures endometriosis." Cures it.
I think they literally believe some.
I think
There's
they
some
do
obviously
believe.
doctors now that know that it doesn't, but I'm like, this is they're telling like young go get pregnant now. Like
Yes.
it'll cure it. It's a myth, by the way, for everyone listening. You can hear probably the snarkiness in our voices because it's not true, but it's an old myth.
Yeah. But still perpetuated because, and I
Yeah.
think it's because there's not a lot of training out there for general
Yeah.
practitioners, and
No.
even like the OBs who've been practicing, or gynecologists who've been practicing for years and years. Like they don't have updated information about this. They just perpetuate what they've been taught. And in some ways I can't blame them for that, although we can blame them for that. I see it both ways. But I had my son. That was not without its struggles. And then, years later, I was, through my regular checkups, my annual physical exams. um, I had to have um, uh, ultrasounds performed,
Mm-hmm.
to just like watch for, whatever might be happening. It was like an augmentation for my annual visits,
Yeah.
which is another kind of torture that we all go through,
Mm-hmm.
when we have this. And my doctor found a tumor on one of my ovaries. And, and she didn't really take anything seriously either. But then I had elevated CA-125 levels in my blood, which can be indicative of ovarian cancer. I went into Sloan Kettering and met with a doctor, Dr. Sonoda. Like, he wanted me in there like yesterday when we sent all of this over to him. And he was the very first person that told me that endometriosis can cause cancer. And I never knew that. I never knew. I was in my late 30s. At this point, I had been struggling with this for like 25, maybe 25 years. And that was the very first time that anyone had ever said anything like that to me.
Yeah, I don't think there was any research probably before that, honestly.
No, but it makes sense. I mean, the cells are growing. Like, the whole premise of this is that cells grow where they're not supposed to.
Yeah.
So, looking back on it, I'm like, oh, okay. Yeah, I guess, that seems to track. But it was really, it was very alarming. And that's what led to my hysterectomy.
Yeah. And when you had that, was the tumor cancerous?
Luckily not.
Was it endometrioma?
It was not an endometrioma. It was like a Brenner tumor that that looked and behaved exactly like it was like a rare tumor.
Yeah.
But when they did, when they put you under to test all of the tissue, because it's sort of like before you have the surgery, they're like, okay, well, if we we flash freeze the sections and we find that something in there is cancerous, we're going to take more stuff, so it's like kind of like a multi-step surgery.
Okay.
So they did say that there were stage 0 cells in my body. That was from the endometriosis. That wasn't from the Brenner tumor, but the Brenner tumor is the thing that got me in there.
Right.
And he was like, you need to, we've got to get this out. Like you really need to take it out. It's a huge risk for you.
High risk. Yeah.
Yeah. And my aunt has endometrial cancer.
Yeah.
But she's never been diagnosed with endometriosis. But it makes me really wonder.
There's still, I really don't think there's enough research on it either. I know, I want to say, and I'm not a researcher or a doctor, so don't quote me on this, but I want to say there have been some papers that link endo to the possibility of ovarian cancer too.
Yes. Yep.
So, but I still think there's not enough research on this disease. There's not enough research on the correlation and, women's health just in general. It's such a huge issue. Yeah.
Yeah. There's a dearth. Most of the way that we're treated in the healthcare system is just, men, but smaller.
Yeah. Yes.
And men,
suck it up,
but make it
too.
Miniature. Yes.
And it's like, stop complaining. You're just whining about this pain. It's like, if you were in this pain, you wouldn't be able to stand. Like they have no clue the level of pain that this disease puts on people.
I mean, I love that whole, like, the calm down, you're hysterical. I have so many, like, I had asked once for my doctor's notes, because I just had a feeling that they had, like, put something in my chart. I was like reading through it. It's like patient called. It's like very upset. Is like in so much pain, and is like feeling is like expressing anger or like whatever is in the chart. I was like, what?
Gosh. Yeah.
But if if a man had that, it would be like,
it'd be like, what?
Cured.
What do you need? Yeah. What do you need? Here's whatever. We'll take care of you.
Yeah. You're on disability now permanently.
Yeah. Yes. Whatever we need to do. Yeah. Gosh. Okay. So you have that procedure. You have the hysterectomy, full hysterectomy?
Mostly. They left one ovary. so that I could help regulate my hormonal levels.
Yeah.
And then he was like, we'll leave it, and you'll
Mm-hmm.
just have to get it. You'll just have to get it. You'll just have to continue to get it monitored. So it
Yeah.
was like, it's one of those things where you have to decide, do we leave it and like keep the hormones, or do we go to with hormone replacement therapy at, in my late 30s? And so, I mean, I trusted him
Yeah.
because he's an expert, unlike so
For
many
sure.
other. I mean, like as much as someone could be an expert in this.
Right. Right.
Um, so yeah, but yes, yeah, the uterus was totally removed.
Yeah.
Um, and I
How have you
and
been
I
feeling?
well, I mean, I'll tell you that when I healed from it, it took me about a year to feel like myself again for,
Mm-hmm.
just my whole body. Um, I still have days where I get that intense body pain, or like that I feel like I have the flu, like, and I'm
Mm-hmm.
coming down with something feeling. But, I'm not spending, you know, 10, 12 days entirely in bed
Yeah.
anymore. And I
Yeah.
remember thinking to myself at one point, this is how men live. That's what I thought to myself. Like,
You're like, wow,
like
this is
I'm
so
a walking
easy.
man. I'm a walking man. Like,
That is so funny. Oh my goodness. Yeah. So feeling a lot better, but you still have your ups and downs because hysterectomy is not a cure for it either. It's a chronic condition, unfortunately. So you still struggle with the inflammation and the ups and downs of cycling because you
yes.
have an ovary.
Yep. Yep. And days when during ovulation, that's a different kind of, torture than the days when
Mm-hmm.
I would have a period. Sometimes I still bleed. And I know that that's like whatever the tissue is, like whatever the tissue is,
Yeah.
the endometriosis that's grown. And I was warned about that. The surgeon warned me
Yeah.
about that. At least he was honest with me. Like he was like, I
Yes.
went in, and I freed your organs again from like their spots, but he didn't go in and like cut everything out. Like he just,
Yeah.
he did what he could.
Right.
So I knew that, that I'd still have it, and I don't want to go back and get it cut out because the the way I felt so disappointed after, and devastated after, it not curing me or like really making
Yeah.
me feel all that much better the first time. I was like, well, I don't want to go through that,
Yeah.
again.
Yeah.
Um, but it has given me a lot of freedom that I never had before, and never really realized I didn't like to the fullest extent, like how little freedom, like how much the endometriosis was like ruling my life, like
Mm-hmm.
how little I was capable of doing, like planning a vacation, um, going out to dinner, riding on a bus, wearing a
Right.
bathing suit. Like, I mean, the list just goes on and on. It's like anyone who's listening to this who has endometriosis or loves someone or knows someone that has it knows this.
Hmm.
Like, we were going to go to the beach today. Nope.
Right.
Or, I mean, it's like on and on. And you don't even understand like the full extent of the way it affects you until some of it is gone. And you just like kind of put two and two together.
Yeah, because I feel like you're so in it, it's your normal. You don't
Yes.
know any different until there's a change and you're like, whoa, this is how the other half live, or people who don't have this disease, like they can not leave the house with like a bag of things planned for just in case, and just
Mhm.
the level of anxiety in the background that's probably not even being acknowledged of like, what if something happens? What if I start to not feel well and I'm on the bus or I'm in the city, or what am I going to do? What if I
Mhm.
start feeling like lightheaded and the pain so bad I'm going to pass out? Like, it's such a crazy way to live because that's your normal. You just think this is how everybody, and then when you take a little bit away, you're like, oh, I don't have to worry about all of this every single day anymore. Like it's a lot. It's very
Yeah.
heavy. That's how you described it. And that's the best way to describe it.
And along those lines too, it's like it's not like we are like, you know, we are the ones who are like, hey, this is normal. Like the medical community,
Yeah.
tells you that it's normal.
Right.
Like they're like, this is all in your head. If you don't like, you like just take some painkillers, go lie down, take a nap, be nice to yourself, eat vegetables, like you're having too much sugar, you're drinking too much wine, you're like, all the things that they say to you. And
Mm-hmm.
like, yeah, I mean, I guess a lot of the dietary things, like they make a difference. Do they cure it? No.
No.
Can they like help mitigate slightly the symptoms? Yes. But still at the end of the day, it's still there and it's still real. And so I think that part of it is also like the psychology of like having to grapple with like, this is my normal and other people say it's normal. This doesn't feel normal. Like, and I think that taps into what you're saying, Melissa, too, about the anxiety of it. Like, the
Yes.
anxiety comes from that too, like the distrust in your own mental state, like your own understanding of the way the world works.
You're starting to question yourself if it's real, or you're making it up in your head. And exactly what you're saying that comes from the medical community is just perpetuating that into a place of where we as patients are like, maybe the pain isn't that bad. Maybe I did have too much wine. Maybe this is my fault.
Yes. Yeah.
Like it's just literally insanity.
I had a doctor tell me once that it could be my fault.
It's
They were like, well,
so
did you ever have unprotected sex? Because if you did do that and you had an undiagnosed STD, it could cause symptoms like this.
it's disgusting. It's a myth, by the way, for everyone listening. That
Right.
is just terrible, and a terrible way to treat you as a
Yes.
patient.
Right. Because
There's,
that I'm a suspect, right? Or like, it's like, what can we find fault? How can we find fault in your character, in your
it's
in your treatment of your own body, instead of like trying to figure out what's going on in your body? Let's try and figure out what you did to cause this.
yeah, yeah, because they don't believe you.
Yeah.
But then it comes from like the systemic lack of education. I hear it's like a 20-minute course in med school. Like every family doctor should be educated in this, because they're usually the first line of defense when a younger person is coming in with these symptoms. They and OBs obviously, but like family doctors should be very well versed in what the symptoms are and be able to identify, at least this could be it. It's not
Yes.
even thought about, I feel like. And to this day, I hate to say it, 2026, I still talk to people on the show all the time that are told, just take some Motrin, you're
Birth
fine. And
control.
yeah, birth control. It blows my mind. I'm like, how are we in this decade and we're still telling people this? It's a lot better than it was. I don't want to be so negative. There is a lot more hope and awareness, and people actually know what the word is. When I first started going through this, people didn't even know I didn't know what the word was, but it's a lot better, but it still has so far to go. So
It does.
far.
It does. And my hope is, that like, even for people, who like us, who didn't get a lot of the initial attention, if we can get people treatment sooner, then
Mm-hmm.
it can maybe stop the progression of the disease being so deep. When I finally got diagnosed, I didn't mention this before, but made me think that, I have adenomyosis too. Like, if we had the knowledge, if we had medical personnel, like people on the front lines, like you said, like, medical doctors who understand how to screen for this in ways
Yes.
that we screen adolescents for other things. Screening adolescent, girls for these kinds of symptoms, can
Mm-hmm.
prevent some of these larger catastrophes from happening down the road.
Yes. The progression, I think, is that I think that what I've heard mostly is like the best line of defense is exactly what you said, is early diagnosis. And I do know there are some tools being worked on, some blood tests, some diagnostic tools that also don't involve surgery. Like, can we talk about
That's
the only
great.
way to diagnose this disease is you have to go under anesthesia and have surgery?
Right. Right. And I remember too, like when I had to do that, I had had a surgery when I was a kid on my arm, and I had had anesthesia like awareness, like I'd woken up during the surgery.
Oh my
And so I
goodness.
was terrified. Like I
Yeah.
didn't want to be I was like, and I couldn't understand like why there was no other way to diagnose. Like I
Yeah.
can't think of anything else that you cannot diagnose,
Right.
without,
That you have to
like,
cut someone's
yes,
abdomen open, you know?
yes. Like
Yeah.
why is I there there has to be another way to be able to determine the existence of this outside of something that extreme.
Yeah.
It's like, well, if
100%.
you really think you have it, I mean, I feel like that's the subtext. It's like, well, if you really think that this is the problem, we're just going to have to go ahead and cut you open.
Yeah.
It's like a
And so
threat.
many,
It's like a
yeah, it
threat.
is. It is. And so many patients have been gaslit for so long that they don't think they have it. They're afraid to have this surgery. Maybe an MRI doesn't show it. And then they really think, oh, this is all in my head, when they really do have the disease. But they've been just pushed down so often. And that's just even more horrific because it's just progressing more and more. It's really not great.
No,
It's
no.
bad.
Yep.
Well, I appreciate you sharing your story. And so you were feeling better because you're about to go on this amazing backcountry snowboarding trip too.
Yes. Yes. Which I would not have ever been able to do if I
Yeah.
still had a uterus. If I were
Yep.
still in a really severe like a severe dealing with severe endometriosis symptoms, I
Hmm.
never would do anything like this. I
Yeah.
dive
Well,
now. I dive too, scuba dive. I never would have done that, before. My life feels really different. It looks really different, you know.
yeah. I feel like you got your life back a little bit.
Yeah, or like it just started.
Yeah.
I didn't really understand what I was missing until I could do it. And then I was like, oh,
Yeah.
wait, yeah.
Yeah. Right. Well, okay. Tell me, you're a poet. Tell me about, so Carey wrote this beautiful, I have an advanced copy, but I love this cover because I'm so into like spiritual stuff, and like I have my like little crystals here.
Nice.
So I like loved this cover, but you said you've written two other books of poetry. Tell me about this one and why it's special and how it's reflective of your journey.
Yeah, thanks. And thank you so much for the comments about the cover too. The artist that did that artwork is Beth Hawkle, and she's a collagist artist, pop art, and everyone should check her out. She's really fantastic. She just did the cover for Counting Crows album too. So yeah,
Wow.
she's great. She's really great. She's very sweet. Um,
And obviously what you've written, some of it I had to like take a break because I felt it so deeply in my soul for what I've been through with endo. And so it's so beautifully written, and I can like almost feel in like the way that I have experienced endo, like what you're conveying.
I'm glad that you think that comes through. I really want that to be the case. I thought for years about writing about this, but so much about poetry is being able to gain the distance. Like you can process your thoughts and your feelings and emotions through the body of poetry, but in order for it to be like for a book for another reader, you have to have a certain element of distance from the material in order to be able to convey not only what's important to you as the writer and as the person that experienced these things, but also what's meaningful, and purposeful, and potentially helpful for the reader. So it took me a long time to be able to feel like I could write any poems in this book because I just had such hard feelings,
Yeah.
intense feelings.
Mhm.
And intense feelings, it's like it's difficult to sort of like parse them. I mean, you just feel like rage, and anger. Like it's
Mhm.
not like that's nuanced. And poetry is not the right body for that. So I I had written the poem, the first poem that, or the poem that was like the sort of like the genesis for this book, is that Ode to Darnell, Ode to the Crocus poem, which is a poem about the nurse at Sloan Kettering that walked me into the operating theater, and just was like so kind and held my hand. And I read that poem aloud for a group at the KGB bar in New York. And, you know, and people felt like, they felt it. And that to me, I felt like was the indication that I was ready to move into this territory and like see if I could write about it now. Like I was in a a mental space that I could write about it. And there's a poem in there too, that's like a long sequence. It's called Gardens of Paradise, Eden Anamnesis, and it has a collage aspect to it in the poems, where I take the medical reports from my endo surgeries, and I've made different collages and like mini poems out of them too. And just the thought of like, cutting up the surgical reports, like that report on how I've been cut up, like it just really deeply, resonated with me. Like reorganizing that mess and sort of reclaiming my story and reclaiming my body too, and my mind, reclaiming my mind from all of that, the preoccupation of being sick, and being chronically ill. Like I just, it helped me reframe my thinking, the writing of these poems.
I think that's really beautiful. And I think it was probably very healing for you to do this. And
Yeah.
I think patients and people who are supporting patients, I think this is a great, just a piece, even if you just want to like read a poem here or there, it's just very, I think, beautiful in the way that you've approached it. For
Thank
people who
you.
are, going through this or supporting someone who's going through this or any real, like really any type of chronic illness.
Thank you. I mean, that's what we always hope, right? That like our stories will transcend ourselves somehow, and and people can find hope or healing, or just like even I feel understood. In a community of individuals who are afflicted by an illness that is not understood, and we all feel misunderstood. We even feel like we misunderstand ourselves. To have that kind of, that firmer footing, or that reassurance, or that kind of support. I mean, if there's any of that, any element of that comes through in this book, it's just, I'm really grateful for it.
Yeah, I think it's wonderful, beautiful that you did it. And I'm appreciative of my advanced copy, but how can people who are listening find you and find this? And we'll link it in the show notes, everyone. So if you're driving, please be safe. Don't worry, we'll link it in the notes.
Well, thank you. You can find me. My website is careysalerno.com. And I'm on Instagram as well, Carey Linnae. That's my middle name, Linnae. So at Carey Linnae on Instagram. And those are my two main avenues. My book that was published by Persea Books, and it's distributed by Norton. So, but you can find the book, on Amazon, The Hungriest Stars. Just type it in there, or bookshop, or any, you could ask your local library or even your bookstore to order it.
Okay, great. And yeah, we'll link that to make sure everybody, if you're listening, that you have it. And we'll link your Instagram too, just so it's easy for everybody to find it. But I really appreciate you coming on and chatting with us and sharing your story with us, and putting something out there, even with this podcast and your poems, just to help others who are struggling. So I really appreciate it.
Well, I appreciate you, Melissa. You're doing the good work, keeping us conversing about this, keeping us in conversation with each other, and, providing opportunities for us to have these kinds of conversations that are really necessary, not only for ourselves, but for each other. So thank you for the opportunity to tell my story and for our conversation today. Just, you're really generous, and I appreciate you.
Oh, thank you so much. Is there anything else you want to add before we wrap up?
Just, love and solidarity to all our endo family out there.
Yeah, absolutely, 100%. And you're never alone. And I like that you started the show by saying that. Like, sometimes it can be very isolating having this disease, but we're not alone. There's so many of us out in the world actually talking about it now, but behind closed doors too. So just remember that if you're having a really hard day, there is a wonderful community, and there is a medical community that is willing to support you. So thank you everyone so much for listening. Watch the video on YouTube and or Spotify if you want to see the cover of the book. And we'll link everything in the show notes. If you feel inclined to, please rate this on Spotify or in Apple. That helps us just get more awareness. Thank you again for listening and supporting the cycle. Bye.